It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Well, our next guest is a very timely one. Dr. George Diaz, infectious disease expert and section medical director at Providence Regional, talking about his background in medicine and the COVID-19 strain. Shannon, this is on all of our minds right now.
Oh, absolutely. You know, Tom, it was slightly a little over a year ago that the first patient was actually seen at Providence Medical Center here in Everett, and Dr. Diaz was part of that team that treated that first patient. I want to ask you, can you imagine it's been over a year? I mean, has it just been one long day, right? One long day.
Shannon O'Kelly and Dr. Diaz on Como.
Dr. Diaz, welcome to Health Talk. How are you?
Doing well. Thank you for having me.
Well, thanks for joining us. Tell us about your background. I mean, it's pretty well known. Providence Hospital here in Everett was the first hospital in the nation to receive a COVID positive patient, I believe, back in February. I've noticed and seen you in the media on the radio and TV talking about this. But here we are 1 year later. Honestly, it feels like one long day to me. It's been a struggle. It's been, I'm sure, in your field of infectious disease medicine, you've probably been extremely busy. Tell our listeners about your background and then bring us up to speed from back in February in today's world, what we know about COVID. How about that?
Sure. So my background is I did my infectious diseases training at the University of Washington. My first job after training was at Providence in Everett. I've been working on antimicrobial stewardship, infection prevention, a number of other programs. I do medical informatics for our health system. And as part of the work, we got our hospital ready to receive patients such as this back in early January. And so we certainly didn't expect to receive the first patient in the U.S., but we're prepared for it. Since then, we've spent a lot of work. We've done a lot of work to start clinical trials with different treatments for COVID. So it's obviously kept us very busy. We've worked on our telehealth model, which has been very successful at Providence to manage COVID outside the hospital and get people treated at the right place at the right time. And so we did all this work, and beginning in late February, started really seeing a huge number of patients come into our hospital, and we managed them at Providence in our pandemic unit. And thankfully, we did pretty well overall with respect to PPE and staff and things, but it's been a long slog. It's been a very long pandemic. We had a little bit of a reprieve over the summer, but beginning around September, the numbers have again increased greatly throughout our county, and we've been dealing with large numbers of patients in the hospital. So it's been quite a long year for us up in Everett to take care of our community.
Yeah, Providence has done a great job. I mean, congratulations to you and your staff and the organization. Tell me and our listeners, did you ever think going through medical school and doing your infectious disease rotation, did they talk about pandemics? Did they talk about the potential for pandemics? And I want to talk to you about the treatment in today's world and the vaccine, but tell us about your training.
Yeah, so my training at the University of Washington, I think, prepares us well for this. Dealing with a pandemic is part of what you train for in infectious diseases. You study about prior pandemics that occurred throughout history. And we've seen more recent, outbreaks that have occurred in other parts of the country primarily, with things like Ebola and MERS. And more locally, even here, roughly 10 years ago, we had swine flu that went through. And so our training prepares us to be the frontline leaders in a pandemic, both locally and worldwide. And so I think that part of training is critically important for anybody doing infectious diseases. This is not going to be our last pandemic, and an infectious disease doctor has to be able to help manage how the response is done towards an infection like this, both at a hospital level as well as a health system level and nationally. So I think we're all ready for this, but it's certainly a surprise when it comes, and then the ID doc is the one really at the forefront in the middle of it.
Tell us, are you guys continually dialoguing and communicating across the nation with other teams? Because I'm sure collaboration is huge in this pandemic.
Yeah, in large part we rely on large national societies like the Infectious Disease Society of America and the National Institutes of Health to provide guidance for the local hospitals in terms of how to treat COVID.
More with Shannon O'Kelly and Dr. George Diaz next on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Continuing our conversation about COVID-19 and infectious disease with Dr. George Diaz and Shannon O'Kelly.
Dr. Diaz, again, thank you so much for joining us. You're an infectious disease physician at Providence here in Everett. I just got to say real quick, I am so thankful as a citizen, a healthcare practitioner myself, that we have people like yourself. I mean, the amount of intelligence and dedication and work going into this is huge. Tell us what you've learned from back in that January of 2020 to today. If someone's admitted to the hospital, is there a treatment cocktail, so to speak, that's become way more efficient and effective?
Yeah, so at this point, patients coming into the hospital with pneumonia from COVID-19, and they require oxygen. In the U.S., the standard of care is essentially steroids and remdesivir. There was a large study in England that proved that dexamethasone, which is a steroid, helps reduce mortality in patients with severe coronavirus pneumonia. Likewise, the data that was published from the NIH as well as from Gilead indicated that the treatment with remdesivir is also beneficial and potentially reduces mortality, especially earlier in the disease. And so what we focus on is identifying people that need to be treated and begin treating them as early as possible. Beyond that, we're involved in a number of other clinical trials. We've been involved in the use of monoclonal antibodies and other therapeutics later in the disease course. And so what we would like to do is for patients to come in the hospital, we give them the standard of care treatment, but also for as many patients as possible, we try to offer them enrollment in the clinical trial. We know that is the way that we can improve treatments going forward. And so we've been very active in that area in a number of different therapeutics across our health system.
You know, it's got to be a challenge. Everybody reacts different to this virus. It's not like you get this symptoms and they're consistent. Some people have such a variety of symptoms, and then the response that some people can have, this immune response. Is that just strange for you guys?
Yeah, we're discovering new things all the time about this virus, the things that it causes and the inflammation that it causes in the human body. But the thing that generally drives people's severe illness and for them to die is the lungs. And so there is a certain degree of predictability about the progression of the lung infection. And what is of utmost importance is when we identify people with COVID that we monitor them closely, measuring their oxygen levels outside the hospital. And then once they immediately, before they begin to drop, that we get them into the hospital setting so we'd start treatment right away. I think identifying people early that are highest risk of needing these treatments are going to benefit the most by us getting them to the right place at the right time.
As we wrap up here, wow, great information. And again, thank you for your dedication. As we wrap up, just real quick to the general public, the vaccine is safe. It's necessary. Get your vaccination. I mean, I just want to emphasize that. Would you agree?
I agree 100%. There are mild symptoms that can be associated with the vaccine, but it is our only way to get out of the pandemic. And I would hope that in Western Washington, our people will receive the vaccine so we can see fewer people in the hospital and fewer people dying from the disease. So we would strongly encourage everyone to get vaccinated.
Thank you so much for your time and information. I tell you what, let's get together down the road when this pandemic is done, and maybe we can just talk about the common cold. How about that?
That sounds great. Thank you.
All right, you've been listening to Dr. George Diaz. More information at providence.org. His background in medicine and, of course, infectious disease, Shannon. And, boy, it's good to have people like him around to listen to because we can certainly use all the information we can get.
I'm so thankful there's people like Dr. Diaz out there helping our organization and people get healthy.
All right, we'll be back with our final segment after this on Como.